Hi friends, welcome to Nursing Online Education. In this video we will be discussing important questions and answers of different nursing competitive examinations. Guys, let's get started. Here is our first question. The following pain medications are ordered for a patient who had a right leg amputation. Oxycodone 5 mg every 4 hours is needed and morphine 5 mg every 4 hours is needed. The nurse administered oxycodone 2 hours ago, but the patient reports pain rated 8 on a scale of O, no pain, to 10, severe pain, as the dressing change begins after evaluating the effectiveness of the pain medication. What action should the nurse take? Blood pressure. 169/98 of a millimeter of mercury. Heart rate. 112 per minute. Respiratory rate. 22 per minute. Temperature. 36.7 C. And the options are: A. Administer additional oxycodone 5 mg. B. Administer morphine 5 mg. C. Change the dressing quickly. D. Ask the patient to wait 2 hours. I repeat, the options are: A. Administer additional oxycodone 5 mg. B. Administer morphine 5 mg. C. Change the dressing quickly. D. Ask the patient to wait 2 hours. The right answer is option B. Administer morphine 5 mg. Here is our next question. To minimize a toddler from scratching and picking at healing skin graft, the nurse should utilize. And the options are: A. Mild sedatives. C. B. Hand mittens. C. Punishment for picking. D. Distractions. I repeat, the options are: A. Mild sedatives. C. B. Hand mittens. C. Punishment for picking. D. Distractions. The right answer is option B. Hand mittens. Here is our next question. A 69-year-old man is admitted to the intensive care unit following cardiac surgery. 2 hours after admission, the nurse performs a routine assessment and notes the patient's chest tube drainage is 200 milliliters and a dark red color. He has had 60 milliliters output from the indwelling urinary catheter. Blood pressure. 138/68 mmHg. Heart rate. 76 per minute. Respiratory rate. 16 per minute. Body temperature. 37.0 C. Oral. Oxygen saturation. 94% 6 L per minute. Nasal cannula. Which findings should be reported to the doctor? And the options are: A. Dark red chest tube drainage. B. Urinary output. C. Oxygen saturation. D. Chest tube output volume. I repeat, the options are: A. Dark red chest tube drainage. B. Urinary output. C. Oxygen saturation. D. Chest tube output volume. The right answer is option A. Dark red chest tube drainage. Here is our next question. Which of the following nursing diagnosis takes priority for a patient admitted to the critical care unit with diabetic ketoacidosis? And the options are: A. Deficient fluid volume secondary to hyperglycemia. B. Risk of infection secondary to weakened immune system. C. Deficient knowledge of cause and prevention. D. Imbalanced nutrition related to hyperglycemic state. I repeat, the options are: A. Deficient fluid volume secondary to hyperglycemia. B. Risk of infection secondary to weakened immune system. C. Deficient knowledge of cause and prevention. D. Imbalanced nutrition related to hyperglycemic state. The right answer is option C. Deficient knowledge of cause and prevention. Here is our next question. When caring for a patient with an ostomy, the nurse knows that extra protection for peristomal skin is most important for those patients with a N. And the options are A. Ileostomy, B. Ascending colostomy, C. Transverse colostomy, D. Sigmoid colostomy. I repeat, the options are A. Ileostomy, B. Ascending colostomy, C. Transverse colostomy, D. Sigmoid colostomy. The right answer is option A. Ileostomy. Here is our next question. Which instruction take priority in reducing anxiety related to surgery? And the options are A. Surgical procedure and postoperative exercises, B. Risk of infection after surgery, C. Advanced directive and what it means, D. Preoperative laboratory result and what to expect on it. I repeat, the options are A. Surgical procedure and postoperative exercises, B. Risk of infection after surgery, C. Advanced directive and what it means, D. Preoperative laboratory result and what to expect on it. The right answer is option D. Preoperative laboratory result and what to expect on it. Here is our next question. Refer to the accompanying figure. The nurse should plan to monitor which of the following at least every 4 hours. Admission. 14 years old admitted 18 hours ago. Report at 22:45, 10:45 p.m. Remains febrile. Maximum temperature. This shift 39.3 C. Respiration rate 12 to 14 per minute. Heart rate 100 to 180 per minute. Blood pressure level within baseline. Normal range. Next dose of intravenous anti-infective is due at 8 o'clock, 8 a.m. Diagnosis. Bacterial. Pneumonia. And the options are A. Vital signs, B. Urinary output, C. Food intake, D. Level of activity. I repeat, the options are A. Vital signs, B. Urinary output, C. Food intake, D. Level of activity. The right answer is option A. Vital signs. Here is our next question. An 80-year-old man presents to the hospital with chronic fatigue, dyspepsia and constipation. On examination he is jaundiced, has red palms, dilated veins around the umbilicus, the abdomen is very distended and he has black, tarry stool on a rectal exam. He is noted to be lethargic and have a flat tone. A paracentesis reveals clear-colored fluid with low protein content. What is most likely diagnosis? And the options are A. Gilbert's syndrome, B. Thalassemia, C. Sickle cell crisis, D. Cirrhosis. I repeat, the options are A. Gilbert's syndrome, B. Thalassemia, C. Sickle cell crisis, D. Cirrhosis. The right answer is option D. Cirrhosis. Here is our next question. A 25-year-old male patient suffered a spinal cord injury at the T4 level and is being cared for in hospital. The nurse enters the patient's room and finds the patient sitting upright and looking anxious and restless. He complains of sudden headache and nausea. Sweat forms on his forehead, yet his feet are cool to touch. Blood pressure 150/100 mmHg. Heart rate 55 per minute. Respiratory rate 28 per minute. Temperature 37.1 C. What nursing intervention is initially most appropriate? And the options are: A. Assess for a full bladder. B. Lower the head of the bed 30 degrees. C. Loosen clothing and bed sheets. D. Apply heating pad to lower extremities. I repeat, the options are: A. Assess for a full bladder. B. Lower the head of the bed 30 degrees. C. Loosen clothing and bed sheets. D. Apply heating pad to lower extremities. The right answer is option A. Assess for a full bladder. Here is our next question. While assessing a child with pulmonary stenosis, the nurse should give priority to. And the options are: A. Deep tendon reflexes. B. Urinary output. C. Exercise tolerance. D. Pattern of food intake. I repeat, the options are: A. Deep tendon reflexes. B. Urinary output. C. Exercise tolerance. D. Pattern of food intake. The right answer is option C. Exercise tolerance. Here is our next question. While caring for a child with a ventriculoperitoneal shunt revision, the nurse finds the patient lying with the head and feet flexed back. The nurse should call for help and prepare for. And the options are: A. Spinal tap. B. Shunt culture. C. Electrocardiogram. D. Ventricular tap. I repeat, the options are: A. Spinal tap. B. Shunt culture. C. Electrocardiogram. D. Ventricular tap. The right answer is option A. Spinal tap. Here is our next question. A woman breastfeed her infant for 1 or 2 hours and her infant cries most of the time and she feels pain in her breast. Which of the following instructions are appropriate for the nurse to give the mother? And the options are: A. Regulate breastfeeding every 3 hours. B. That's normal feeding problem. C. Shift to bottle feeding. D. Start weaning your baby. I repeat, the options are: A. Regulate breastfeeding every 3 hours. B. That's normal feeding problem. C. Shift to bottle feeding. D. Start weaning your baby. The right answer is option A. Regulate breastfeeding every 3 hours. Here is our next question. Which of the following positions should the client with appendicitis assume to relieve pain? And the options are: A. Prone. B. Sitting. C. Supine. D. Lying with legs drawn up. I repeat, the options are: A. Prone. B. Sitting. C. Supine. D. Lying with legs drawn up. The right answer is option D. Lying with legs drawn up. Here is our next question. Which of the following is the most common symptom of myocardial infarction (MI)? And the options are A. Chest pain, B. Dyspnea, C. Edema, D. Palpitations. I repeat, the options are A. Chest pain, B. Dyspnea, C. Edema, D. Palpitations. The right answer is option A. Chest pain. Thanks for watching. Subscribe for more videos.